You're watching The Source on CNN Philippines. I'm Pinky Webb. The Health Department has yet to detect an Omicron COVID-19 variant case based on the latest genome sequencing run of the Philippine Genome Center. The DOH says that the country's current biosurveillance measures are enough so far against the new corona variant. Let's go straight to the source of the story. We have WHO Country Representative Dr. Rabindra Abeyasinghe. Dr. Abeyasinghe, welcome to the source and thank you so much for your time.
Thanks so much for your time.
Good morning, Pinky.
All
Pleasure
right.
to be here.
Can we start with facts in terms of the Omicron so far? Three things that need to be known: its transmissibility, its severity, and its effect on the vaccines. Can you help us on the latest here on Omicron?
Yeah, let me start by saying we don't know a lot. We are still trying to understand the Omicron variant. It appears that from initial reports coming out of South Africa that the Omicron variant is more transmissible than the globally predominant Delta variant. Now, there is a caveat in that because where the Omicron variant emerged in South Africa, Delta was not the predominant variant. So we're trying to understand how Omicron will compete with Delta. And this is what we are looking at on a global scale. Since Delta is the globally predominant variant, what we know is it appears to be quite transmissible because of the numerous mutations on the spike protein. Mm-hmm. And this also means that the Omicron variant has already been confirmed in a short duration of about 2 weeks. Since its early detection, 3 weeks, we have already confirmed the presence of Omicron either in travelers or in local transmitted cases in 57 countries. So this is a reflection of the fact that it transmits pretty easily. On the other hand, reports coming from the South African Medical Association indicate that a lot of the infections are mild. But we need to look at this carefully because if it's significantly more transmissible, this means that the virus will reach all the corners of the world, including in the Philippines. Yeah. And if it causes a lot of mild infection, that would be a good thing. But we also need to keep in mind that mild infections affecting elderly vulnerable groups could overwhelm the hospital capacities again. And so even if it overall causes mild disease in those vulnerable groups, it could cause severe, moderate, severe, or even death. And so we need to be careful in our assessment of saying it doesn't cause severe disease because it could have severe outcomes in some immunocompromised and elderly individuals. And that would then lead to, because of sheer numbers of the higher transmissibility, lead to an overwhelming of the healthcare capacity, which we need to try to prevent again, because if we see an overwhelming of the healthcare facilities and the workers, then again, we would have to consider how we are going to manage that situation. And we don't want to go back to the ECQ, MECQ era when we are now trying to keep the economy open through the alert level systems. So preparedness and delay is critically important in how we manage this. And the last question that you asked, how would it respond to the treatments? We are confident that because the mutations are largely in the spike protein and the treatments recommended by WHO, namely the corticosteroids and the interleukin-6 inhibitors, don't work through that channel, that those treatments will remain fully effective. On the other hand, we don't know how it will react with the vaccines, whether the vaccines will still be able to protect us. What is clear is that the existing vaccines are very likely to protect people from severe disease and death. With regards to infections, mild infections, it's already been reported in some countries that mild infections are there when post-vaccination. But the vaccines were never expected to protect people from getting infected, we knew that the vaccines could only protect from severe disease and death.
Right.
So this is not an entirely surprising observation. What we know is that if people are fully protected, the likelihood of them getting infected or developing severe disease is much lower. So this is what we know at this point of time, and we need to use what we know to see how we can minimize its potential impact. Now, the good thing in the case of the Philippines is that you've had a big outbreak of Delta with a lot of cases and unfortunately a lot of deaths, but that's given you the opportunity to strengthen your health system and so prepare, because basically the preparedness is about managing, detecting, improving your surveillance, managing the infections in the hospitals, improving your healthcare capacity, access to oxygen, etc. So that we need to continue to keep strengthening. That would be useful not only for COVID variants, but even beyond, to strengthen the health system post-pandemic. And that we continue to urge the government to do. On the other hand, what we need to also try to focus is how good is our surveillance systems in detecting the entry of the variant into the country. And there we see some concerns about the capacity of the system to trace the arrivals and sequence those cases that require sequencing. So there are still areas that we need to improve. And besides that, it's also about the quarantining arrangements for positive arrivals, because it is critically important to try to limit the transmission if people are positive, even if we haven't confirmed whether they are Omicron at this point of time.
Okay.
So,
Dr. Abeyasinghe, there are two things I wanted to focus on among what you explained to us. One is the spike protein and the surveillance, the biosurveillance, or the tracing also of the passengers coming into the country. But before we proceed, we just need to take a very short break. This is The Source on CNN Philippines. Please stay tuned. Our breaking news, the country's vet Beatriz Luigi Gomez enters the top 10 of the 70th Miss Universe competition. The pageant is now being held in Israel. She's still in the run to win the country's 5th Miss Universe crown. Gomez's placement in the top 10 continues to quote placement streak of the Philippines since 2010. Other countries who made it to the top 10 are Paraguay, Puerto Rico, USA, India, South Africa, Bahamas, France, Colombia, and Aruba. The top 10 will compete in the evening gown to determine the next set of finals. We will give you more details as soon as they become available to us. And of course, you're still watching The Source on CNN Philippines. Our guest today, WHO Country Representative Dr. Rabindra Abeyasinghe. So before we went on a break, I wanted to ask you about the mutation of this Omicron. From my understanding, it had about 50 mutations, and 30 or 32 of those are actually found in the spike protein. My question here is, because of the mutation in the spike protein, does that necessarily mean it's a deadlier virus or a more severe virus? Would that be a correlation of some sort?
Correlation of some sort.
I would say that that's premature to say that, because it could. The issue with the spike protein is that many of the vaccines target the spike protein, and this is why we are concerned that we may see reduced efficacy of the vaccines. If this is proven to be the case, then again, this variant could end up being deadlier, as you pointed out. But we don't have any evidence at this point of time that this is the case. What we know at the moment is that the vaccines will continue to prevent severe disease and death.
Okay.
And that is why we continue to urge vaccination of the most vulnerable groups. We have a very unique window here in the Philippines. If you remember, a few months ago, we had a similar window before the arrival of Delta. And we are urging the government now to use this window to vaccinate as many of the priority elderly groups and the A5 groups and the comorbid populations, so that they are better protected when the Omicron variant eventually arrives here. which will happen at some stage because this appears to be of higher transmissibility.
It's not a matter of if, but when, as the DOH was saying. In terms of vaccination, we have about 40 million fully vaccinated, and we have a second round of vaccination days from December 15, 16, and 17. And we did do quite well during the first round at almost 10 million. How do you see the pace by which the Philippines is vaccinating the public?
The Philippines and the national government and the task force should be congratulated on the success of the NVD1. This is phenomenal in a country. I think you have globally the fourth highest rate of daily vaccinations among any country during that campaign. As I said, we are in a unique situation where we have vaccines in the country now. I believe we have almost 50 million vaccines in the country. And so we have a very unique opportunity of being able to protect the most vulnerable so that we save the most number of lives ahead of the arrival of Omicron. So the NVD2 that the department is planning this week, I know there is now a cloud with a tropical cyclone or a typhoon approaching. But again, I understand the DOH is already starting in those regions where the typhoon is likely to make landfall, so that ahead of potential arrival on Wednesday, Thursday. So we're still trying to do as much as possible so that we protect as many people as possible. And I want to also take use of the opportunity to reiterate that WHO and COVAX are fully supportive of the government's efforts. We have already delivered almost 36 million doses. You may recall we promised to deliver vaccines adequate to prevent 20% of the Philippine population. So 36 million doses. We are on track to deliver, I believe, another 12 million doses or more than that within December. In fact, we are trying to bring in, starting tomorrow, we will be bringing in 9 million doses of single-use J&J to augment the NVD2 so that we can fully protect more people before the end of the year. But besides that, we are also bringing in other vaccines. We are also bringing in almost 12 million doses of Moderna. We are bringing in another 1.6 million doses of Pfizer and 1.6 million doses of AstraZeneca this month. So this is a lot of vaccines that we are bringing in, 22 million actually, within this month. And we hope that shows that we will far exceed the original 40 million doses that we pledged to deliver to the Philippines this year. And we are continuing to hope that we can work with the government of the Philippines to protect as many Filipinos as possible, as quickly as possible.
That's way above the pledge, huh? That's about, from the numbers you gave me, it could turn up to about 50 million doses from a pledge of 40, if I'm not mistaken. But I just want to go briefly to one more thing, just related to this. Booster shots have been open for the public, and so far, I'm looking at about over 700 shots given so far, knowing that, of course, 40 million of the population are fully vaccinated. It seems that the over 700 is a very small percentage. Knowing that booster shots allow the person to increase its antibodies, especially with the Omicron variant, are you at all concerned that we're not boosting? There are not enough people getting booster shots?
So let us be clear. Our first priority is try to protect as many of the people who've not received any vaccines, particularly in those vulnerable A2, A3, and A5 groups. But recognizing the huge volume of vaccines you have in the country, it seems a good thing to use these vaccines even to additionally protect people by giving booster shots. And we recommended that booster shots be given to the most vulnerable, meaning the healthcare workers and those elderly over 60. Going in to use booster shots for the general population, may be acceptable when you have a lot of vaccines, but the focus should actually be on ensuring that those who have not had any vaccine get them first. And that's where our concerns are, because we are at about 65% of the elderly A2 population fully vaccinated, leaving about 2.1 million elderly people who have not been able to access even one shot.
Okay.
So in those circumstances, we are saying do both. Do the vaccination of the elderly and the vulnerable groups, but because you also have a large stock of vaccines, think about using them so that you protect as many people as possible to the maximum. We know that if you are not immunocompromised, the initial doses are enough to protect from severe disease and death. If you are immunocompromised, you need the boosters.
Mm-hmm. One last topic I wanted to discuss with you. You had earlier talked about this biosurveillance, of course, and the problem that beset us or confronted us when authorities could not find some of the passengers coming from South Africa. The latest numbers, December 9, genome sequencing was at about 48, and 38, I believe, of the 48 genome sequenced, that came out December 9, just to be sure about this. 38 was Delta, was of the Delta variant. Do you think, although let me just add this context, that in a whole week, according to experts, there were about 600 or 574 samples that were genome sequenced. My question is, do you think that we are genome sequencing enough? Because this is the basis to find out if Omicron has actually entered the Philippines. If we have about an average of maybe 400 to 500 infections a day, do you think we are genome sequencing enough?
So let me start by saying WHO commends the Philippines for its genome sequencing capacity. You are doing a lot more genome sequencing than many other countries in the region. And WHO has also supported the Philippine Genome Center to expand its genome sequencing capacity, in fact, to double its capacity from an early number of about 300 to 700 sequencing per week. And I believe now you can do about 1,400. So this is good. But unfortunately, what we understand is that not enough samples are being collected and sent to PGC for sequencing. And if I recall, there were about 265 arrivals from among overseas Filipinos who tested positive since the announcement of the Omicron variant. And we were hoping that all of these could be sequenced, but many of these samples have not been routed to the PGC, and therefore the numbers of sequencing were what you just mentioned. So this is why I said you have the capacity, but we need to do better in our preparedness by sampling, testing everybody. And by testing everybody, we are also saying we need to be testing the most recent arrivals, because those are most likely to have the Omicron variant.
All right.
And we need to also sequence not only people who come from countries with confirmed Omicron variant, because we know that there is limited sequencing capacity in many countries. And so there may be arrivals who are testing positive from countries who have not confirmed Omicron yet, that may be carrying the Omicron. So I think we need to sequence everybody and all the positive arrivals, but also just to make sure that we don't have it in country, it would be useful to also sequence some of the positives that we are detecting in the country to see whether we missed it at some stage and it's already crept in. We are looking closely at the trends of infection. We are not seeing increase anywhere at this point of time, but that could be a pointer on also where you should prioritize testing if you see a sudden increase in cases in some areas. So the combination of testing arrivals and transmission hotspots within the country is necessary. And you have the capacity to hold genome sequence more samples. So it's best to do that now because it will give you lead time in being able to respond and hopefully arrest the transmission.
All right. WHO Country Representative, Dr. Rabindra Abeyasinghe, thank you so much for your time.
For your time.
Thank you, Pinky.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.